work of the Jefferson County Health Department and the leadership of Dr. Mark Wilson is absolutely vital to our community. Our current working vision at the School of Public Health is that we aspire to fulfill the great promise of the discipline of public health to protect and improve the health, safety, and well-being of all. We can best accomplish this through not only the research and teaching that we conduct and provide, but through our strong ties and our partners in public health practice. And chief among these is our relationship with the Jefferson County Health Department. Dr. Wilson, thank you for being that partner, and I look forward to hearing you address the state of the county.
Thank you, Dean Irwin, and thank you to the School of Public Health for hosting this event. I was actually pulling for Auburn because I always pull for the underdog. So, War Eagle. The UAB School of Public Health is a very important partner, as Dean Irwin mentioned, for our health department. The school has recently been helping us with our community health assessment, which we conduct every 5 years, and that community health assessment helps inform our own strategic plan as well as the work of the Jefferson County Health Action Partnership and other partners, including local hospitals. As I go through my talk, you'll hear some other mentions of where the school is involved in our greater work. Thank all of you for being here. So many friends in the audience. It's just wonderful to see you all. Thanks for being here. For those of you that I promised to pay to be here, I'll meet up with you afterwards. I always struggle to prepare for this particular talk because I feel that when you say state of the county's health, there's an expectation that I will give some sort of comprehensive overview, which is really impossible to do, let alone in the short amount of time we have. So I prefer sometimes just to call it public health address. That sort of lowers the bar for myself a little bit. For those of you who may not know me, I'm your friendly county health officer. A few of you may not really know what a health officer is. When I first got the job, somebody asked me if I was the guy that goes to the restaurants. I do go to restaurants, but I'm not the guy. In fact, I try to take my badge off whenever I go into a restaurant so as not to scare people too much. I don't wear a uniform or a special badge or a special hat like some officers do. But I do have certain duties that are assigned to me by state public health law, along with our Board of Health, including investigation and abatement of diseases or conditions detrimental to the health of people, along with some degree of authority to carry out those duties. It's the staff of the Jefferson County Department of Health who carry out most of those public health duties, and the Board of Health is its governing body. I would love to share with you all the great work that our staff at the Health Department do just in this past year. But again, it's impossible to encapsulate all of that work in this short talk. I do invite you to take a look at our new and improved website and follow us on Facebook and Twitter. Like, share, and retweet what you see so others will be informed of the great work we do and information that our community frankly needs to have. So what I'm going to do today, and I'll just say ahead of time, if you're looking for recognition in this talk or some piece of work that you are doing or you are involved with personally, a lot of you are going to be offended because, again, I cannot cover it all in one talk. So I'm just going to focus on a few of the major, big public issues that we are facing in Jefferson County, and especially some of those that we have chosen as strategic priority areas for our Department of Health in our strategic plan. Our 2017-21 strategic plan was informed by our earlier community health assessment called Community Matters 2020. Many of you are participating in that plan community-wide even now. This assessment included reams of health data, surveys of community members, input from external stakeholders, and our own staff. Our plan is ambitious, but I'm pleased to say that it's still an active plan, and we're continuing to update it each year. Our strategic plan has 4 major strategic priority areas: the scope of services that we provide or promote, our relationship with our customers and the county population as a whole, our own employees and our internal culture, and our use of technology and tools. What I'll focus on today are some of the major areas where we seek to expand our scope of services, either offered directly by the health department or through partnerships, and in some cases where we may seek to change environmental factors or influence policy to improve health. Those areas are chronic diseases, infectious diseases, mental health and substance abuse, and birth outcomes and infant health. I'll briefly touch on violence and homicides as a public health problem. Chronic non-infectious diseases continue to be a leading cause of death and disability. Heart disease is still number 1, and cancer, chronic lung disease, stroke, and diabetes still rank among the top of the list. Obesity, high blood pressure, and tobacco use are underlying conditions that contribute to much of this disease burden. Many of those conditions are at least partially preventable, and healthy lifestyles, including healthy eating, exercise, and avoidance of tobacco products, are still important underlying factors, and yet very challenging for us to meaningfully impact. We continue to advocate for policies for tobacco-free public spaces for all of Jefferson County, and several of our local municipalities have adopted strong tobacco-free ordinances. But we'd love it if the Alabama legislature would save us all some time and effort and pass a statewide comprehensive tobacco-free law. We've seen some decline in cigarette smoking over the past several years, but recently vaping among youth has been increasing at an alarming rate nationwide, and our local school officials are seeing it here as well. This graph from the CDC's Morbidity and Mortality Weekly Report from last November shows trends in vaping and overall tobacco product use among youth over the past few years. In this graph, the black lines on the top are the percentage of students who reported in a survey that they used e-cigarettes or any tobacco product in the last 30 days. Just so you know, nicotine, whether it's in tobacco leaves or in vaping fluid, is considered a tobacco product. So e-cigarettes here are a subset of any tobacco use. You can see that we've had a recent dramatic increase in e-cigarette use among teenagers. A lot of those kids are being exposed to a highly addictive drug, nicotine, sometimes without realizing it, and during a time of their life when they are generally very susceptible to addiction because their brains are still developing. Data so far shows that teens who vape are almost 4 times as likely to go on to smoke regular cigarettes. We're putting extra effort into educating the public about the dangers of vaping among youth. We're hopeful that the Birmingham City Council will soon move to include e-cigarettes in its smoke-free ordinance. And JCDH is working alongside UAB, Children's Hospital, Cooper Green, the VA, and the Southern Research Institute to have an area surrounding our campuses established as a health district in which not only are these campuses smoke-free or tobacco-free, but the adjacent sidewalks are too. A bill has been recently introduced in the current Alabama State Legislative Session, House Bill 41. I encourage you to look at it. It would place greater restriction on the advertising and sale of alternative tobacco products such as e-cigarettes. This would include a requirement that stores who sell these products post warnings on the dangers of these products, as well as a prohibition of advertising that targets youth. We also advocate, and our board has passed a resolution in support of an increase in the purchase age of all tobacco products in Alabama to 21, including e-cigarettes. Alongside all of these efforts in the policy area, we're working to expand our own tobacco cessation services for the community at large. To help address obesity and physical inactivity, we are continuing to support construction of the Red Rock Trail system. You see a master plan of it here. We're in the process of setting up a fund to leverage local matching funds needed to draw down federal funds to help support this built environment work, in addition to other environmental protection projects for our community. We continue to support efforts in the community to improve healthy food access, including continued funding of the Double Up Food Bucks program, in which Supplemental Nutrition Assistance Program recipients can use their electronic benefits card to double their purchase at local farmers markets and when they buy fresh fruits and vegetables. We're conducting a pilot project that focuses on screening for and managing blood pressure in a zip code in Birmingham known to be affected by a high incidence of uncontrolled hypertension and its complications. We're soon adding a special metabolic syndrome clinic to our own clinical services. We struggle, however, to have good real-time local data on chronic non-infectious diseases on a county-wide basis, and especially at a zip code or census tract basis. Unlike communicable diseases like tuberculosis, there's no mandatory reporting system to public health for conditions like diabetes or hypertension. We're trying to address this with our own data on our own patients through our electronic medical record transformation and other data infrastructure improvements within the health department. But we hope to find a way to work with local healthcare providers, including hospitals, to obtain more comprehensive population health data so we can do a better job of targeting our efforts and measuring outcomes in the area of chronic non-infectious diseases. The next area is infectious diseases. Our health department's disease control division continues to stay very busy with thousands of disease investigations each year, in addition to direct services, including disease treatment and vaccinations. But today I want to focus on three particular infectious diseases of interest. The first is syphilis, which continues to be a stubborn problem that's on the increase nationwide. You can see on this graph that it is trending upward in Jefferson County as well. This concerns us greatly in Jefferson County because we have the unfortunate history in the past of being the syphilis capital of the country many years ago. But also of concern is not just syphilis, primary syphilis or syphilis in adults, but congenital syphilis that has occurred in a few cases over the past 3 years. So later this year, JCDH will be expanding its STD clinic from just one site located at our Central Health Center to all three of our sites, including Eastern Health Center, Western Health Center, in order to make it more accessible to more people across the county to come in, get screened and treated for syphilis and other sexually transmitted infections. The other disease of interest is HIV and AIDS. Here are the number of new cases our own disease investigators interviewed for the last few years. Our hope is that we will continue to see a downward trend, as you see here, because this is where we have a really big opportunity. In theory, we should be able to get the number of new HIV cases down to 0. If we can diagnose at least 90% of the people who have HIV infection, get 90% of those retained in treatment, and maintain 90% of those on highly effective antiretroviral therapy such that their viral load is undetectable, we can get to 0 transmissions of HIV in our community. That's because HIV treatment providers are able to get the viral loads down to undetectable levels in most cases, and undetectable equals untransmittable. We have people living with HIV now who can have sexual activity, unprotected sex, and not spread HIV if they're on adequate treatment. We can also prevent new cases of HIV by identifying HIV-negative individuals who are at high risk of being infected with the virus and put them on pre-exposure prophylaxis, or PrEP. It's because of this tremendous opportunity that we have made getting to zero a priority. We're continuing to partner with UAB, AIDS Alabama, Birmingham AIDS Outreach, the State Health Department, and others to build on the great work that they've already done in this area and develop a new community-wide strategic plan to drastically reduce the number of new HIV cases. Also, in this past year at the Health Department, we have started a new HIV PrEP clinic. So far, a total of 76 people have received PrEP services at JCDH. The third disease is hepatitis C. We currently have an epidemic of hepatitis C, and for a lot of people that is silent, meaning they either don't know they have it or they have it and have not yet developed symptoms or complications. It used to be mostly a disease of baby boomers, people like me. But now we have a new wave of infection among people born after 1965, and most of that is related to injection drug use. We started a new hepatitis C treatment clinic at the Health Department last year, and we're continuing to advocate for passage of a new law in Alabama that would allow health departments to establish syringe service programs either directly or through an agreement with partner organizations. These programs get contaminated syringes and needles off the street and replace them with clean ones to reduce the spread of bloodborne diseases such as hepatitis C and HIV. Participants would also be linked to other services such as substance abuse treatment and health care. There is no evidence that these programs encourage more drug use. In fact, experience from across the country has shown that drug users who participate in syringe service programs are more likely to get into treatment for their drug use disorder. The next area of priority for us and our community at large is mental health and substance abuse. In partnership with Jefferson Blunt St. Clair Mental Health Authority, or JBS, we are embedding a mental health provider within our own adult primary care clinics starting this month. This service is being paired with psychiatric pharmacotherapy services in our clinics in partnership with Samford McWhorter School of Pharmacy. For our own clinics, this step towards responding to a need identified in our previous community assessment and our own healthcare providers is being taken. We are trying to get away from the idea that mental health should be viewed as different from physical health. I have news for you. The brain is connected to the rest of the body. Fortunately, we've seen this same recognition in our larger community with other healthcare providers stepping up their efforts to provide more mental health services and more who are taking an integrated approach. Substance use and overdose deaths began to get our attention in about 2013, and we began working with several partners in a community-wide effort called the Pills to Needles Initiative in 2014. You can see here the trend in opioid overdose deaths as the crisis developed in Jefferson County. Because there's some overlap in heroin and fentanyl deaths, in other words, there are some cases in which both were present in the victim's system, and the medical examiner was unable to determine which was the cause of death. I combine these here as heroin and or fentanyl. So these numbers on the blue bars are the total numbers of people who died rather than the number of times fentanyl or heroin was detected. The orange part of the bar represents the number of people who died from an overdose of prescription opioids alone without any other drugs present, just to give you an idea of those relative numbers. I do have to give a lot of credit here to our own local coroner's office, which is the best in the state. They provide excellent data in toxicology on our overdose deaths. And that, unfortunately, is not available in much of the rest of Alabama. There are many overdose deaths that involve multiple drugs, including opioids, benzodiazepines, alcohol, cocaine, and methamphetamine. Unfortunately, we have seen a recent significant increase in methamphetamine or crystal meth related deaths over the past couple of years, so it's making a resurgence. The total number of overdose deaths, opioid and all others, reached its highest level in 2017 with 269 deaths. That number was down to 228 in 2018. I hope we've turned the corner on this, but it's too early to know if that's really true. JCDH continues to conduct overdose response training and distribution of naloxone kits in the community. In recent months, we've had some breakthroughs with law enforcement, where officers in some jurisdictions are now being equipped with naloxone and reversing overdoses in the field. Working with partners in the substance abuse treatment community and with the Crisis Center of Birmingham, we helped establish and fund the new Recovery Resource Center, which began seeing clients in May of 2018. This is a free service to anyone seeking assistance for a substance use problem. They furnish information, formal assessment, referral to appropriate treatment, and peer support. In less than a year, they have already assisted over 900 people, way beyond what we expected. We recognize that the work is not done for our current opioid crisis, and we recognize that we will always have substance use issues to deal with, including new drugs that we don't even know about yet. To continue this work and help maintain community readiness, we've renamed the Pills to Needles initiative as the less confusing Addiction and Recovery Alliance. We did have a few people come and say, is this where you get your needles? So we changed the name. We are in the process of organizing it into work groups around the priority areas you see here. We welcome partners to join us in these work groups. There's a lot of good work going on, and there are new federal dollars coming into our state for treatment of opioid use disorder. But the idea here is to find areas where we can accomplish more working together as a collaborative or an alliance than working separately. We've made it a major priority to improve birth outcomes and foster optimal infant health and development. Keeping children healthy and safe during the first few years of their lives and helping them to get off to a good start emotionally and mentally will have an impact that will last a lifetime, and it will pay dividends to our community as a whole. Here are our Jefferson County mortality rates, trended over a few years. The number of infants per 1,000 who die before their first birthday. The gray line in the middle represents our overall infant mortality rate in Jefferson County through 2017, the most recent year that we have. That rate of 10.5 is significantly higher than overall Alabama's rates. The red line at the top represents non-white infants, and the bottom blue line represents white infants. So you can see there is still a marked racial disparity, although that disparity is gradually decreasing. We partnered with several local foundations to help the UAB School of Nursing establish the Nurse Family Partnership, a nationally recognized, evidence-based nurse visitation program for first-time, low-income pregnant women, following them through birth and until age 2 of the child. Nationally, this program has been shown to increase maternal employment, increase the father's presence in the household, and decrease maternal smoking, childhood injuries, child abuse, child behavioral and intellectual problems, and even child crime later in life. JCDH has made a substantial long-term commitment of financial support for this program. At the last count I received from the School of Nursing, our local Nurse Family Partnership has had 101 babies born in the program since beginning in late 2017, with a lower than average preterm birth rate. And at 6 months and 12 months following delivery, 98% of the mothers are working or enrolled in school or a job training program. Breastfeeding initiation, that is remarkable, isn't it? They have a really great team in the School of Nursing. Breastfeeding initiation is at 80%, and we look forward to seeing a lot of other outcomes data as they come in and as the program matures. The UAB School of Public Health is providing additional evaluation of this local program beyond an already stringent evaluation process required by the national office. Our health department also launched the From Day One program in February 2018. Designed by JCDH staff, the From Day One program is a lower cost community health worker program to support pregnant women from the first trimester of pregnancy through age 1 of the child and connect them to other resources and help them succeed. It is not restricted to first-time pregnancies. JCDH partnered with Connection Health to provide training and oversight of the community health workers. We also provide baby safety showers for all of the families. One of those families is shown here in this picture. So far, From Day One program has had 58 births. They are reporting a 78% breastfeeding initiation rate, and a 95% of the infants have received their well baby visits and immunizations on schedule. For both of these programs, we're making sure all babies' mothers have cribs, along with safe sleep training. We've also provided a grant to Birthwell Partners, a local doula program, to increase access to their services for low-income pregnant women and to measure their outcomes. To make sure these new initiatives are being coordinated with local efforts and other efforts, we've established a countywide maternal child health roundtable. The UAB School of Public Health is assisting the roundtable with resource mapping and gap analysis for maternal child health services in our county. Last year, we added the problem of violence to our strategic plan. It isn't something that our health department has devoted resources to in the past, but it is clearly a public health problem. There were 161 homicides in Jefferson County in 2018. This is about the same magnitude of deaths that you see with our opioid crisis. Here you see the rate of homicides per 100,000 population. Again, this is a rate and not an absolute number. From 1988 through 2018. The blue line at the top is the rate for the city of Birmingham, and the red line is the rate for Jefferson County overall. You can see that we are near the high rate of homicides we've seen in 30 years. During the last several months, JCDH helped support the city of Birmingham with its recently unveiled plan for reducing violence called the Peace Strategy. This is now posted on the city's website. We're continuing to look at other ways in which we might be able to help address this problem through a public health approach. Again, we are new to this, so we need a lot of help. Dean Irwin has convened a group of experts from different schools and departments at UAB to help with this process. So I've only touched on some of the new initiatives aimed at addressing some of the major issues in our strategic plan and facing our county as a whole. There is much more I'm unable to cover here. And there's the important day-to-day work that over 400 employees at the Jefferson County Department of Health do to fulfill our mission, to prevent disease and assure access to quality health care, promote a healthy lifestyle and a healthy environment, and protect against public health threats. To see more of that work, I invite you to take a look at our new 2018 annual report, which is now posted on our website. Finally, I want to touch on health equity, which rose to the top of the list in strategic issues at our last community health improvement plan and was interwoven into the health department's strategic plan. Our simple definition of health equity is this: everyone has the opportunities needed to attain their highest level of health. During 2018, our managers at JCDH participated in a 2-day equity, diversity, and inclusion training provided by the Jefferson County Collaborative for Health Equity. I recommend that you use this training for your own staff and your own organization. We then developed our own health equity guidelines for the health department, and we are further developing training for our employees. JCDH staff worked with other partners in the Jefferson County Health Action Partnership, as you can see on this slide, to develop the 2018 Community Health Equity Report. This is only the second report of its kind for Jefferson County. The first was in 2013. I would encourage you to take a look at this as well and use it. It is posted on the Health Action Partnership website as well as our health department's website. People are free to steal that, is that correct? Steal pages from this and use it in your own presentation. This report shows the relationships between place, race, income, and other social determinants of health and health outcomes. Just as an example, here's one map in the report showing the differences in life expectancy between different census tracts. The darker blue being the highest life expectancy and the darker red showing the lowest. Just one other example, this is looking at the differences in infant mortality rates, with the darker blue being the lowest or the best, and the darker red being the highest or the worst. These are just some examples of the content in this health equity report. The report illustrates that there's much more work to be done to achieve our vision of a healthier Jefferson County for all. Thank you for your attention.